Yep.
Hi, I'm Brockton Graul. Today I'm going to be showing you how to insert an IV. First, you want to verify your order. Next, you want to gather all of your supplies necessary for inserting the IV. You want to identify your patient using two identifiers and checking their identiband. After you've done that, you want to introduce yourself and let them know that you're going to be sticking them to put in an IV today. You want to confirm any allergies to meds, iodine, chlorhexidine, latex, and tape. After you've confirmed any allergies, you are going to assess for appropriate placement and any contradictions for the IV. So dialysis access site, history of mastectomy, history of trauma, any former IV complications, or any frail or fragile veins. Next, you're going to assess the patient for any previous IV therapy experiences. You're going to then perform your hand hygiene and apply your tourniquet 4 to 6 inches above your anticipated site. So once you've got your tourniquet on, you're going to state where you're putting your IV. So I'm going to be inserting the IV right here in the cephalic vein. Next, I'm going to apply my clean gloves. After you have got your clean gloves on, you want to grab your chlorhexidine and clean a large area for about 30 to 60 seconds using a back and forth motion. After you've done that for about 30 to 60 seconds, you want to give it time to allow it to air dry. Next, you're going to get out your needle and ensure that you have ease of movement here in the hub. So after you've done that, you want to anchor the vein, pulling down with your thumb. Warn your patient of a stick and stick at a 10 to 30 degree angle with your bevel facing up. So once you have stuck your patient, you are going to then release the tourniquet and advance the catheter a little bit more. After you've done that, you want to apply pressure at the tip of the catheter and withdraw your needle. After you've withdrawn your needle, you want to activate the safety and put it in your sharps container. After you've done that, you want to grab your tubing here. Attach your tubing here. And then after you've got your tubing attached, you want to grab your syringe and flush with 2 to 3 cc's of normal saline. And while you're doing that, you want to observe for pain or any swelling. After you've done that, you want to remove your syringe. You want to remove any blood or anything coming on that's on the skin. You want to prep it on both sides, and then you want to get a piece of tape and secure your catheter here. It says to use a transparent dressing, but we actually don't have any. So I'm just gonna be using tape and gauze. So after you've done that, grab another piece of tape and your gauze. Making sure that you're not taping over the hub. After you've got what would normally be a transparent dressing on, you want to label the date, time, gauge size, and your initials. And then you want to grab another piece of tape. And take your tubing and loop it upward and tape to secure your tubing here. After you've done that, you want to discard any sharps you've had into the sharps container, which we've already done. Remove your gloves and document.